Hi everyone, I am Dr. Jayasri. I am a practicing pediatrician in Coimbatore for the past 20 years. I am indeed delighted and happy to meet the adolescents who will be listening to this talk, and also the parents and teachers to discuss an important topic, adolescence. Adolescence is indeed a very challenging phase, not only for the children who are entering it and going through it, but also for the people who deal with adolescence day in and day out, especially the parents, teachers and doctors. It is challenging in multiple ways to you because you end up juggling a bit during this phase. You have to manage multiple tasks. Say for example, education, you have to make a path for your career, and you have to manage the biological changes which happen during adolescence in your body. You also have to manage multiple emotional changes which happen during this phase, and yet come out successfully at the end of the adolescent age group. It is also challenging to the people who handle you, because as parents and as lay people, we do not know why you go through a lot of emotional changes and how to tackle you. So this session, we hope to cover the biological changes which take place during this phase, and also a bit of explanation about what happens to the brain during adolescence, so that it will give us better understanding of the emotional changes and the behavioral changes which happen during this phase. So you know that all living species in this world go through developmental stages, right? So human beings also, we go through lots of changes, starting from before birth, when you are called a fetus inside the mother's womb, and when you are born, you are called a neonate or a newborn, which is the first 30 days of life, and then you are called an infant till 1 year, and from 1 to 3 years you are called a toddler, and after 3 you are called a child, and from 10 to 19 years it is adolescence, and after 19 to 21 you become an young adult. This is common to both males and females. So these are the various stages through which you go through, and we have to face the changes which come along with this age group, so that you pass smoothly from one phase to another. During this changes, most important phase when maximum growth happens in every child's life is the first 1000 days of your life, which is 270 days inside the mother's womb, that is the 9 months, and 730 days, which combines 365 days of first year and 365 days of second year. So these three put together form the first 1000 days of life, which we called as a golden period, because during this phase the rapid growth happens than any other phase in our entire life. And during this phase only the organs are formed, and you also go through many milestone changes. The same way, the next important growth phase, where we use the word growth spurt, is the adolescence. So between the two, the childhood, the growth happens in a very sequential and a normal way. So during adolescence, which is sandwiched between childhood and adulthood, we can divide this adolescence as early adolescence, mid adolescence and late adolescence. 9 to 11 years is called pre-adolescent phase. 11 to 14 years is called early adolescence. 14 to 17 is called mid adolescence, and 17 to 19 is called late adolescence. But by the biological changes and the changes which happen in the brain, we can even consider a person as adolescent till the age of 21. And during this phase, maximum changes happen to your body. What are the challenges which you face during this period of adolescence? If we talk about emotions, you go through a roller coaster ride, right? So on one side, suddenly you become very excited and emotional and also super elated. On the other side, sometimes you enter into frustration and you lose your self-esteem. You want to be quiet and silent, and you want some personal space for yourself. So this sort of roller coaster ride of emotions happen mainly during adolescence, and this is the time when, as parents and teachers, we also do not know how to manage you. So during adolescence, one important phase which you go through in life is called puberty. Puberty is a term which covers the maturity of the reproductive system of a boy or a girl. And this puberty starts a little early in girls, say 10 to 12 years, and gets completed by 15 to 16. In a boy, it starts around 12 to 14 years and gets over by 17 to 18. During this phase, the body grows rapidly, both in boys and girls. So, if you take the weight of a boy or a girl at 10 years, the weight doubles by the end of puberty. So, say 30 kilos, a 10-year-old child reaches 60 kilos to 70 kilos when they reach 17 to 18 years. The same way, height also increases to the extent of 23 to 25 centimeters during the whole phase of puberty. And this height development contributes to about 20 to 25% of your adult height. In boys, the changes are more towards muscular development, whereas in girls it moves towards more of fat deposition and a less muscular development compared to boys. Also, this is the phase when you start thinking on your own. You think abstractly, you start making decisions, and you also try to be socially responsible, sharing many responsibilities in the family and the society. And along with sexual maturity, emotional maturity also happens during this phase of puberty. What is responsible for the beginning of puberty in children is an important gland which we call as an endocrine gland called pituitary. A pituitary is an endocrine gland which is situated at the base of the brain, and this gland secretes many hormones which are essential for the maturation of the reproductive system, also for the physical growth and mental growth. So, if we take the pituitary, it is divided into anterior and posterior pituitary. Anterior pituitary secretes the important hormone called gonadotropins, and these gonadotropins stimulate the secretion of sex hormones in boys and girls. What are these gonadotropins? They are the hormones called FH, follicle stimulating hormone, and LH, luteinizing hormone, FSH and LH. The next important hormone secreted by anterior pituitary is the growth hormone. This growth hormone is responsible for the height and weight development, that is the development of muscles and bones. Then you have the thyroid stimulating hormone which acts on the thyroid gland and make it secrete the thyroid hormone, which is necessary for the good function of reproductive system as well as for height and weight development. Then we have hormones like ACTH which acts on the adrenal cortex to secrete adrenal steroids, which are also essential for sexual maturity. Along with this, the posterior pituitary secretes two important hormones called oxytocin and vasopressin. Oxytocin is a hormone very active in females especially. It acts in two sites. One is the breast, where it helps in ejection of the milk and during lactation, and second is on the uterus to contract and help in the safe delivery of the baby. So, it happens during the end of pregnancy. Another important hormone by anterior pituitary is prolactin, which is very important again in females because prolactin is the hormone which stimulates milk secretion during lactation. In boys, FSH and LH, that is gonadotropins, act on the testes and help the testes to secrete testosterone, which is considered the male sex hormone. So, this is the hormone pathway starting from pituitary. But for the function of the pituitary, you need a gland called hypothalamus which secretes certain hormones to make the pituitary work properly, and these are called the gonadotropic releasing hormone. So, whenever you use the word releasing, it helps in the release of other hormones. So, gonadotropic releasing hormones stimulate the pituitary to secrete the pituitary hormones, which is gonadotropins and growth hormone, and in turn also help in the secretion of testosterone in boys and estrogen and progesterone in girls. So, this completes the hormonal cycle in every boy and girl. So, as we saw early, these changes in the hormonal secretions start from the age of 10 to 11 years in girls, and the first change you see in a girl is the development of breast. So, the breast tissue development which starts by the age of 10 to 12 years is called thelarchy. which is followed by the secretion of adrenal hormones along with estrogen, which helps in the development of the next phase called pubarch, when axillary hair, pubic hair and breast engorgement happens during this phase. Then you have the next phase called menarche, which is the beginning of menstruation. So menstrual cycle beginning marks the hallmark of puberty in a girl. If any girl doesn't have even one cycle of menstruation before the age of 15 years, it should be considered abnormal and you have to refer this child to a doctor to make sure that the hormonal cycle is all right. Same way for boys, if the secondary sex characteristics are not seen before the age of 15 to 16, we should consult a doctor. So what happens in boys? In boys, during the phase of puberty, muscular development overtakes fat deposition. So they become more muscular and they start having hair in the body. For example, facial hair, hair on the body, hair under the axilla and also the pubic hair. The voice change happens during puberty. Why the voice breaks in boys and not in girls? Because due to the effect of testosterone, the laryngeal cartilage expands and that laryngeal cartilage expansion is seen in front of the throat as Adam's apple. You can see I am pointing to the Adam's apple, which will be very prominent in boys and not in girls. And the vocal cords are situated inside the larynx and the movement of the vocal cord produces sound in all of us. So in boys during puberty, because of the effect of testosterone, this vocal cords thicken and also loosen a little bit, and that is why the voice breaks. In girls, the voice continues to be high pitched and little shrill during puberty. Then comes the formation of acne. All of you develop pimples, whether it is girl or boy, which happens during puberty. This is because of the increase in the number of sebaceous glands in the body and they start secreting an oily secretion, which is responsible also for a different kind of odor or a stink, which is more commonly felt in adolescence. Every time when you move here and there, especially after an exercise or after a workout, I am sure your parents would have told, please take bath, we are unable to bear the smell. So this is because of the excessive sweat as well as the oily secretion which enhanced during puberty. And all these changes are brought about by the hormone called testosterone in boys, and in girls it is because of estrogen and progesterone. So going through this puberty, which usually coincides with the early and mid-adolescent phase, and then final maturity happens during late adolescence. So you emerge as a very handsome boy or a beautiful girl at the age of 18 to 19 years. So when a matured boy, as we saw, has hair all over the body, also has developed mustache and beard and underarm hairs, a cracked voice and muscular, and this is the phase when you can also show your six packs if you want to, and your genitals are fully developed, where the testicular volume increases and also the penile length increases and the penis enlarges, and this stage is ready to do the functions of the reproductive system. In the same way, in girls, if we consider the development of the reproductive system, the help of estrogen and progesterone, which helps in settling the menstrual cycle, which happens every month, and also in the development of the breast, and the female contour or the body shape takes place and gets established during this phase of puberty.